Hi, I'm Dr. Alvarez, and today I want to explain a little bit about the gastric sleeve. What it is it for you? How is this procedure performed? What can you expect from it? And we're here at Endo Hospital, and we're here a little bit more intimate setting, not the bright lights, not our studio, but I wanted to come to you in a more intimate manner. We're here in our meeting room, and just you and I and a screen. So I want to explain a little bit about the gastric sleeve. I know a lot of patients come to us via internet, via emails, via phone calls, and also patients that come or are planning to come for physical consultation with me. And I know this information will be very useful to you before you come down to my office, or if you want to know more about what the procedure is and what can do for you. Okay, so first let me start by saying weight loss surgery is it's the most effective and known method to give you better quality of life and an extra lease on life. So it is a procedure that will take care of quite a bit of comorbidities. This is medical conditions that are related to patients who are obese. You can talk about, actually, I believe I have a slide. This is the major newspapers posts from the United States: Chicago Tribune, Washington Post, USA Today, AP, Boston Globe, and they're all stating that weight loss surgery will, in a few words, it will prolong your life. Okay, so also it's a great treatment toward diabetes, and this is a slide I wanted to show you. This is a slide from the ASMBS, which is the American Society for Metabolic and Bariatric Surgery, maximum authority in the United States regarding weight loss surgery, and you can see a whole bunch of medical conditions and their percentage of conditions being resolved after weight loss surgery. And you're talking about high blood pressure, sleep apnea, diabetes, venous insufficiency, reflux, cardiovascular disease. But the most important thing here I wanted to point out is mortality is reduced in about 89% at 5 years. That means your lifespan is going to be prolonged, number one. And the other thing, probably the most important thing, is quality of life. Quality of life is improved in about 95% of the patients after they get weight loss surgery. So that is what you can expect out of weight loss surgery. But let me tell you a little bit about this procedure in particular. This procedure, like no other, is very, very unique. And this procedure is a procedure I like to focus on. This is what I do every single day, several times a day. And I truly believe on this procedure. This procedure I learned back in about 2005, and I was part of the team that probably was the first doing this procedure in Mexico, and probably in the United States as well, because that was 2005, 2006. In the US, this procedure was authorized until 2009. By the time it was authorized by the FDA in the United States, we had already done about 2,500 of this procedure. So anyway, this procedure in particular, what we do is we eliminate this part of the stomach. Why do we do this? Well, we're practically changing the gas tank, and you're going to be feeling satisfied with much less food while eating. But there's a big plus. This part of the stomach we remove out of the abdomen. We take it out, and the reason we take it out is, number one, we can't just leave it in there because it's out of blood supply. It'll just rot in there. We need to pull it out. But there's a really good reason to take it out, because this part of the stomach, the fundus of the stomach, there is a hormone called ghrelin. Ghrelin hormone produces head hunger, anxiety to eat, and it is greatly reduced in about 80% right after 24 hours of your surgery. Less anxiety to eat, less less cravings, less head hunger in general. So when patients decide to sit down and eat, they're going to be able to eat a lot less food. How much less food, you may be asking yourself. If you're eating before surgery on a scale from 1 to 10, you're going to be eating about a 10 right now. With this procedure, patients are going to be able to eat about a 3. That means about a third of food. Okay, so that way less than half of what you're currently eating is what you can expect after surgery. The rest of the energy, the rest of the calories your body needs, well, it is taken from that stored fat in your body, and that is why patients lose weight. So this procedure in particular has many advantages. Number one is, if you notice, the entrance of the stomach is the one you are born with. There is no change in this, so stays natural. And the exit of the stomach also stays the same, and the intestine stays untouched. That means the absorption of nutrients and vitamins and minerals and all this practically stays the same. We don't mess around with the intestines. We're not bypassing intestine. We're not doing anything to it, just reducing capacity, head hunger. All right, that's how it works. Now, a lot of patients may ask, well, are there any side effects of this? Really, there isn't. It's just weight loss. There is a percentage of patients that may suffer from some heartburn after surgery. Mainly patients who have heartburn already, not de novo, not new heartburn, totally controlled with medications. But the main function of this is to preserve this indentation here, this valve right here, which is the pyloric valve. The pylorus is an important valve that I like to preserve. This procedure does that. Why? Because this is a natural valve that God or your supreme being actually created for you. And it is a very intelligent valve. This valve opens and closes depending on the food and the digestion. So it is important to keep the normal physiology in your body. And the only thing we're practically doing is reducing hunger, as I was saying a few seconds ago, and capacity, less capacity. Here it is again. And unlike any other procedures, there is, number one, there is no foreign body in the procedure, like the lap band. Lap band is a elastic ring, a plastic ring placed on the upper part of the stomach. That is something that is outdated in our practice. We don't do it anymore. What we do now is actually pull out a lot of those lap bands and convert them into gastric sleeve surgery. But anyway, in this procedure in particular, there is absolutely no foreign body inside of you. Therefore, there is no maintenance, no need to fill lap bands, unfill lap bands, or that foreign body causing any issue inside of you. In this case, the sleeve is well calibrated. We normally reduce the stomach capacity between 70 to 80% of inpatients. And the other thing in comparison to other weight loss surgery procedures, like for example the gastric bypass, where you're actually bypassing the pyloric valve and part of the intestine. So in that procedure, the gastric bypass, you are having malnutrition, malnourishment intentionally, and it may be a struggle down the road. Here it is again with some anatomy. You got the spleen over here, you got the liver over here, and how the final result. Notice the intestine completely untouched. Now, we've done over 15,000 of these procedures since late 2005. This is a procedure that takes me about some 25 minutes to do on a regular patient. it didn't take me that long when we started back then. It would probably take us about an hour and a half, hour and 40 minutes. And well, practice does make perfect. It's something that we have been working together with these gentlemen that we have here, and as part of my team, it's something that we have done again and again, and everybody knows they're part of the recipe. This team is how we craft stomachs every single day, and everybody knows they're part of the play. So if you repeat the play every single day, guess what? You get way better every single day. So right now, our team, myself, takes us about some 25 minutes to craft a brand new stomach. Normally for local patients, the stay is about it's just 24 hours, it's just one night stay, you're out the next day. For out-of-town patients, we do require patients to stay 2 nights with us, just to keep an eye on you. This right here is I think I can't play the video, but this is, if you go to salsaaftersurgery.com, I wanted to show you this video where you will have patients salsa dancing after 24 hours. Let me tell you a little bit about the story here. This patient of mine right here is a salsa instructor, and the day after surgery, I found them on the hallway. There were actually he was teaching the rest of my patients how to salsa dance. So this just proves to you how much pain or how fast your recovery is. This is just 24 hours after surgery, no IV lines, they're salsa dancing, they're consuming ice throughout the following day, and the recovery is fairly quick. The reason is because it's done through laparoscopic surgery. That means we don't open patients up, 5 tiny incisions, we go through your abdomen with tiny little instruments and a camera, and we work and craft everything without big incisions that require long hospital stays, long and prolonged recoveries, etc. So patients for a regular desk job may return to work between day 3 to day 5 after surgery. Very fast recovery. Those are the incisions right here, and we do 5 tiny little incisions. 5 millimeter are practically half the size of the nail of my pinky finger. So it could give you an idea. Right here, they're magnified, but the measurement is in millimeters. The incisions are very small. Down the road, those incisions are practically they dissipate, they kind of blend in. This is one of my patients after 8 months, and they start to disappear with time. You can barely see little marks on this patient 8 months after surgery. We take extreme caution to make them as small as possible. I know they're small. We try to go a little further, make them smaller. Okay, so we talked about the other procedures, gastric bypass, lap band surgery. Why is this procedure superior? Well, weight loss with the sleeve is in some studies very similar to the gastric bypass, but without looking into the gastric bypass side effects or problems down the road. Problems with the gastric bypass, you're talking about marginal ulcers inside your stomach. You're talking about malnutrition, malnourishment, protein deficiency, osteoporosis, risk of internal hernias, so on and so forth. It just goes on and on and on. Anemia, etc. It doesn't happen with the sleeve though. So in this case, the sleeve is less likely to give you any issues down the road versus the gastric bypass. And we talked about the lap band, where there's a foreign body inside of you, where in this case, there's no foreign body, there's no problems with maintenance, filling bands, unfilling bands, etc. So who is a candidate for weight loss surgery? Not anybody can be a candidate for weight loss surgery. You need to figure this out first, or in this case, me, and you need to qualify for weight loss surgery. So it all goes by body mass index. BMI. Patients need to know this, that us bariatric surgeons follow the guidelines by BMI, body mass index. So if you're more than 100 pounds overweight, automatically makes you a candidate, you qualify. But if your BMI is over 40, it also makes you a candidate. And if your BMI is over 30 with comorbidities, this means if you don't need to be that big, you don't need to be that heavy if you have certain comorbidities like diabetes, maybe you have high blood pressure, maybe you have sleep apnea. Well, if you have any of those conditions, lower back pain, swelling of your feet, any type of these comorbidities make you qualify for surgery without being that overweight if your BMI is 30 and you have one of these. And of course, patients have a normal history of not being able to lose weight for even though they've followed certain diets, they've struggled with weight for over 5 years. So you may say, well, doctor, the body mass index, the BMI, I really don't know what it is. Well, it's a measurement we take out of your height and your weight. And it's very simple to get that BMI. You can Google BMI, body mass index, and pick a calculator. There's a whole bunch of them. You could probably get one there's an app for your phone as well. Or you can, let me jump on this. You can go to my website and endobmi.com, and it's easy, accessible, it's free, and you can check your BMI out. So classification of, depending on your BMI, between 19 and 25 will make you normal in your normal weight. Between 25 and 30 you would be overweight. 30 to 35 you would be obese. 35 to 40 you would be severely obese. Over 40 you would be morbidly obese. That means, the word morbid means sickness. That means it is related to a certain disease or certain condition like diabetes, high blood pressure, sleep apnea. This is where we normally see these conditions appear. And then there is other categories like a BMI over 50, which is super obesity, a BMI over 60, which is called super obesity, and so on and so forth. So depending on your BMI, which is something we need to get, you can classify yourself in any of these categories. From here on, you may be eligible for weight loss surgery, in this case the gastric sleeve, and from here on you definitely need weight loss surgery. So I wanted to show you a little bit about what we've done throughout the years. These are just a few of my, my 15,000 patients that we've done. If you go to my website, you'll find hundreds, literally hundreds of before and after pictures. Probably one of the widest databases of before and after pictures regarding gastric sleeve surgery. So this is Tyler, by the way. This is the gentleman that was doing the salsa dancing on the slide I showed you. Yvonne got to goal after 8 months. Now Anthony, some people say, some experts say that for high BMI patients, maybe this sleeve surgery may not be suitable. Maybe you need to go a little bit more aggressive, like with a gastric bypass surgery or duodenal switch. Well, this is Anthony. He was a big boy. He is down 140 pounds in 8 months. Probably the most a patient has lost under my care with a sleeve procedure is 400 pounds. So this is talking about a patient that's close to 600 pounds at the time of surgery. Losing 400 pounds gets him to 200 pounds. All right, so the sleeve is a very powerful tool, and the more you use it correctly, the better outcome you will get. 100 pounds in 5 months. Diabetes resolved, or at least under remission. And this is a case I'd like to point out. Before and after, but if you put a lot of effort, maybe you want to tone your body even more exercise, lowering the carb intake, the results are simply astonishing. We've done certain patients from The Biggest Loser as well, where patients go to the show, they lose this patient lost, give me a second, this right here. This patient went to the show, lost 70 pounds. And after 12 months, she, after the show, after 12 months, she regained the weight. And this is her after gastric sleeve surgery with us. We've done other patients from The Biggest Loser as well. This is David. David is the brother of Sean William Scott, the actor from American Pie movie, or Dukes of Hazzard. And David, he's a golf instructor. David had a problem with weight, obviously. And here's David afterwards, after his sleeve surgery. So how about you? When will you take the step to win? Why? Because weight loss surgery will make you win in life, win extra years on this planet, will make you win and have better quality of life, get rid of a lot of comorbidities that you probably already have, medical conditions, get them under control, and just live longer and better. So I know you've probably received maybe some information from us. If you haven't, or you want more information, you can always go to gastricsleeveinformation.com, and you will have a more thorough information from my practice and myself. If you are scheduled to come down to my office for a consultation, you probably already got this information. Otherwise, my staff or myself will be bringing you or giving you this information while you're here with us. So you'll get a lot of information from us. How much pain is involved? Am I the best surgeon to choose for the surgery? How much will it cost you? Are there any financing options available? Complications, long-term side effects? Go to gastricsleeveinformation.com for this. And of course, you can always find me throughout social media. Choose your platform. We're probably there. We have a lot of fun, and probably also I'm the publisher of 6 books already on the topic of the gastric sleeve. I think I was probably the first doctor to publish something, a physical book on the gastric sleeve back in about 2009 or so. So, wow, that's almost 10 years ago. So anyway, you can find the books on Amazon, and of course, you're welcome to look for my show. The Ask Dr. A show is a weekly show. We receive questions from all over the world, and we transmit the show in 2 languages, English and Spanish, every single week, and you can find the show on YouTube. Finally, probably my favorite platform, because I do everything daily. I take care of that personally, that social media account, which is my Instagram. You're welcome to join me, text me. It'll be me replying, and at least have it behind the scenes of what we do every single day, and we have a lot of fun doing it. All right, so again, I'm Dr. Alvarez, and if I can help you with anything, don't think twice to getting in contact with me or my staff. Thanks so much for watching.